Hello, my name's Ken. I am one of the imaging specialists here at Vic Complete Care Emergency Room. One of the things that separates us from an urgent care to an ER is the fact that we have the ability to both do x-rays and CAT scans, as well as ultrasound. So depending on the symptoms that a patient presents when they come to us will depend on how quickly we need to get you back to do some diagnostic studies so that we can expedite your treatment process. So come on back and I'll give you a quick tour of our imaging lab. Welcome to our x-ray suite. This is where the majority of our basic imaging gets done, especially orthopedic. So a patient who has harmed their ankle or sprained their wrist or injured their neck, typically the first route we go is x-ray, generally because it's due to less radiation and it's less invasive for the patients. Typically we are using a wall bucky or a bed bucky, okay, table bucky, for larger body parts, okay? Anytime we want to look at the rib cage, pelvic area, and typically we have patients standing straight upright in order to get air fluid levels is typically what we like to do. As far as abdomens go, we can do any mixture of. A lot of times a patient can be in so much pain that them laying down is really not an option. So sometimes we can manage to get the x-rays done here. Welcome to our CT suite. So this is where the magic happens. When we get patients that have extreme symptoms, okay, we're worried about stroke, we're worried about appendicitis, we're worried about something vascular, we're gonna rush them to me. And typically, in a situation, let's say that we've got a stroke patient. Well, first thing we wanna do is we wanna scan their brain. We wanna scan their brain so that we can see if there's any abnormalities, and we wanna get that out to the doc as soon as possible. That way we can start getting them ready for whatever the next step might be. Now, a CAT scanner is very similar to x-ray, as it has an x-ray tube, but it has multiple x-ray tubes and it has multiple scanners. So really what happens on a CT scanner is you've got several x-rays being taken at once, and what happens is we push the body through as that scanner is scanning, and what you end up with is kind of a helical or axial slices of a patient. And what that does is it gets sent to a very elaborate reconstruction algorithm, and it creates these 3D images for us, which are really beautiful. CT, very important when it comes to ERs. Over here, we have a portable x-ray machine. Okay, now this is very important. Anytime we get a patient that is immobilized or they're in such a critical condition that we really don't want to move them, we want to be very cautious, we can actually take the x-rays to them. So it's almost the same exact thing as we're doing in the old x-ray suite, but we're taking it to their room, which is awesome. We like that. Over here, we have even got an ultrasound machine at our disposal, okay? So this is for patients that come in with serious injuries or even an appendicitis, let's say, but it's on a child. We don't want to give them radiation, okay? A CAT scan can be a tremendous amount of radiation, and we try to avoid that as much as we can. So what we will actually use is an ultrasound machine. We can also use that to rule out blood clots of the legs like DVTs and things like that. Really good service, serves us well. Welcome to my workstation. This is where we take all of the images and we make sure everything is top quality, optimal, and we send it off to the radiologist. So here we've got a brain that I scanned earlier today, okay? And believe it or not, is actually normal, is what the radiologist read to us, but I was very concerned first thing in the morning because I typically don't see calcification to this degree in a patient's ventricles. But luckily for the patient, everything turned out A-okay for him. So in these situations where we finally get the images for the patient, we send them off to a radiologist, okay? We use ARA, they're very quick, they get right back to us, and they can converse with our docs and even us techs on what the best avenue for treatment might be. Here we're looking at a shoulder x-ray. I sent that off earlier today. I believe it took 10 minutes for us to get a reply on the results for that x-ray, which is pretty impressive, all things considered.
The good news is the ankle is not broken.
Well, I hope you enjoyed our tour. Just remember, if you have any extreme abdominal pain, extreme headaches, slurred speech, drooping of the face, please come see us, okay? We're here 24/7, and we can do some diagnostic imaging for you.
Complete Care, the ER with a heart.